You have an opinion to a reasonable degree of medical probability as to whether Dr. Roz met or fell below the standard of care in this case in treating Ms. Sherrer?
Yes.
And what is that opinion?
He fell below the standard of care.
And could you explain to the jury why you believe that and what the facts are underlying that opinion?
All right. So when someone is there to be evaluated, once again, you want to go through the proper evaluation of not only history, physical examination, but going through the whole differential diagnosis of what could be causing the complaints and the symptoms. Now, we don't hold physicians accountable to know everything, but we do expect them to actually run the process to go through. The other part that is really the key is that, like myself, we are trainers of other physicians, our physicians that are going to be taking care of all of us in the room. And when you have that, you actually have a heightened responsibility to actually teach and train what is appropriate. And that appropriateness is actually to go through the whole process of making sure the patient understands what you're doing, why you're doing it, what are the goals of therapy, what are your expectations from the outcome, and they have that full informed consent process. So obviously he has an international practice. Patients fly in. Ms. Sherrer came in from China, had one visit with them. At that visit, he did a full evaluation as far as history, physical examination, did not consider some of the other issues, and already put together a plan of surgical intervention, which, due to some other issues, scheduled it a few months down the line. She had some other things that she needed to attend to. Some of it was insurance basis, decided to postpone that surgery to 14 months later. The issue that I really have with it is that she comes back 14 months later. She undergoes...
And I put the timeline back up just so you have that.
She undergoes video urodynamics test. She then gets a cystoscopy done by another physician. The next day she has a transvaginal ultrasound. The next day she has an MRI. All throughout those, she has never met formally with Dr. Roz again.
When did he see her again?
He saw her the Friday morning of surgery, roughly 6 a.m. At that point in time, had her sign a consent, where she already probably has an IV in place. She knows that she's having surgery, which is under duress. Yet there's no time that they ever came back and discussed the results of any of the tests. There was no discussion as far as what are your expectations, what are your goals, what's the expectation of surgery, what are the risks, what are you really having, do you really know what you're having? You've been 14 months gone into a different country, you just fly in and we're going to operate. That is not how I would want any surgeon to actually treat patients, let alone a surgeon who's teaching fellows and residents, doctors to be. That is not appropriate, and that is below the standard of care.
Did he also fail to meet the standard of care in not properly evaluating her fully prior to surgery, in addition to the consenting issue?
I think in his mind, as his testimony that he stated, it was she had pain, she had mesh, I removed the mesh. And he stated that over and over.
Is that appropriate?
You know, surgeons have their own thinking. In Dr. Roz's mind, based on his deposition, that's the way his philosophy was. His philosophy is he is a surgeon. He's a surgeon who operates a lot. He's 77 years of age and continues to operate. It's almost like you're just a technician, as opposed to other physicians who want to kind of understand the longevity of a patient. What am I going to do when I operate? What am I going to leave you with? Knowing that there's going to be unintended consequences. You will be incontinent after this. You have a high likelihood of having pain persistently. And what are you going to do then? So the surgeon's role is really to look at the whole patient and then be able to follow that patient throughout.
Let me ask